Ready, everybody? Good afternoon, everyone. I am KP George, your Fort Bend County Judge. As we have promised, the information, as and when the information is available, we do everything in our power to keep our residents and all jurisdictions informed about this situation. We are working around the clock with all local, regional, and statewide health authority to monitor the situation and update the public. While this is a serious health threat, we encourage residents to rely on verifiable source of information and remain calm. Next, I will introduce a team of experts throughout from this region. We are blessed to have some of the top public health officials with us today. With that, I will introduce to you Fort Bend County Health and Human Services Director, Dr. Jacqueline Minter, to provide an update on the individual situation. Thank you. Dr. Minter.
Thank you, Judge George, and good evening. First, I would like to acknowledge the presence of our regional local health authorities, Dr. David Purse from the City of Houston and Dr. Umer Shah from Harris County. As you know, diseases and disasters do not respect jurisdictional boundaries. We are fortunate to have a great relationship and a great partnership within this region, and I sincerely appreciate the support of my colleagues. Thank you. At 4 p.m. this afternoon, I was notified that a person who resides in Fort Bend County has a presumptive positive test for COVID-19. The test was performed by the Houston Health Department Laboratory and is being sent to the Centers for Disease Control in Atlanta for confirmation. If confirmed, this represents the first positive COVID-19 case in the state of Texas from a non-repatriated person. This person is a man in his 70s who traveled abroad and became ill after his return to the U.S. He is currently hospitalized and in stable condition. As this case was associated with travel, at this time, we still have no evidence of community spread of COVID-19. While we know this news is concerning, it is not unexpected. We have watched the numbers of cases increase daily across the U.S., and it was just a matter of time before Texas announced its first case. This is a rapidly evolving situation, and we know it's unsettling for our residents. We want you to remember that there are things that you can do to protect yourselves and your families. Remaining calm is of utmost importance. You can help by not going to the emergency room unless it's essential. Emergency rooms need to be able to serve those with the most critical needs. If you have symptoms like a cough, fever, or other respiratory problems, please contact your doctor. Secondly, you can practice healthy hygiene habits every day, and those will help to prevent the spread of respiratory illnesses like COVID-19. Wash your hands often with soap and water for at least 20 minutes, especially after going to the restroom, before eating, after blowing your nose, coughing, or sneezing. If soap and water are not available, use an alcohol-based sanitizer with at least 60% alcohol. Avoid touching your hands to your face, eyes, nose, and mouth. Avoid close contact with people who are sick. Stay home if you are sick, and cover your sneezes and coughs. If you don't have a tissue, cough into your sleeve, not into your hands. And remember to wash your hands after coughing or sneezing. You can clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe.
Thank you, Dr. Minter. At this point, I wanted to invite City of Houston Public Health Authority, Dr. David Purse, to give you an update. Doctor?
Judge George, Dr. Minter, thank you for allowing the City of Houston to participate. We, with the City of Houston, we're going to have a press conference of our own this afternoon or perhaps tomorrow morning to announce that our lab now has the capability to test for the virus that causes the COVID-19 illness. As you know, there were problems when the test was rolled out earlier. Those test issues have been resolved, We are doing our own internal testing and verification, which is part of the normal process, and that includes testing some actual samples. And so that's what happened today, was we did a test on some actual samples, which we were going to ensure were all being run properly, which we have in this case before we made the public announcement. The test results you have heard are characterized as presumptive positive, and that's the way that they are described. However, the CDC also points out these are, in fact, actionable results. So we believe that the result is, in fact, an actual positive. It will undergo a confirmation process at the CDC, but at this point, we have no reason to believe that there's anything other than accurate, and it is, in fact, actionable. And so this is why we are moving forward and acting and behaving as if it's actionable, because it, in fact, is. And so beginning tomorrow, the City of Houston's laboratory will have testing capability. We're going to be coordinating that messaging to all of the clinicians, hospitals, doctors' offices, and clinics in the region. There is a process which they're familiar with, and we will reorient them to in terms of how the testing can be done here locally. For those that have already submitted tests, they know that process. There are some very minor tweaks to it due to the fact that we'll be able to test locally. The big difference is that we're going to be able to get test results much more quickly than we have in the past several weeks. Having said that, there is still a limit to the amount of tests that we can run in a day. So I strongly encourage people to be patient with us as we get the testing process up and going. We don't want to wind up in the situation that the CDC has been in, where there are more tests that are coming in than we can run in a day. And we will, in fact, be prioritizing tests based on the need, based on the description of the patients. For example, as someone who's had no travel and has no exposure to anyone with any illness, and he has no symptoms, but he just simply wants to be tested, they will not be tested ahead of somebody who has reason to be tested because they may have a travel history, or they may have been in an area, whether it be internationally, where there's cases moving around, or if they have symptoms. So there will be a prioritization that will occur. Thank you.
Thank you, Dr. Pearce, for that update. And at this point, I wanted to invite Harris County Public Health Authority, Dr. Umesh. Doctor, please come forward.
Thank you, Judge George, for having us here this evening. I want to underscore what my colleagues have said. I also want to express gratitude for your leadership, and Judge Hidalgo, as you all know, with Harris County. Judge Lina Hidalgo remains committed to working with you and our regional elected officials. Dr. Minter, thank you for your leadership as well in this. I know that this is a challenging situation, and I want to underscore the message that she has provided, which is it is a concerning development that we have had our first presumptive positive case. However, I want to make sure that everybody understands that that is something that we have been planning for, we have been preparing for some period of time. The reason that Dr. Pearce, myself, and others stand together is that our regional public health departments have been working together, we've been planning together, and we've been planning for a number of different scenarios. And so it was a matter of time before we were going to see the first positive in our community. As Dr. Minter has said, we do not have evidence of community spread. But this is a good reminder to all of our community members, including within our healthcare community, but also our community members at large, that this is the time for all of us to continue to do all the things that we can do to prevent ourselves from getting sick or spreading that to somebody else if we ourselves are sick, which is, again, washing our hands, covering our coughs, and if you yourself are sick from any type of respiratory disease, we want to make sure that you do not go somewhere where you can infect others. And whether that's not sending your kids to school, making sure that they don't get others sick, or making sure that you don't go to work, making sure that you don't go to large gatherings. If you yourself are sick, as Dr. Minter said, we want to make sure that your first step is to contact your healthcare provider. Harris County Public Health remains supportive of the efforts here. We remain supportive of all the activities that are happening across our region, and we remain monitoring along with our partners to make sure that we continue to protect our communities. Thank you.
Thank you, Dr. Shaw. At this point, I just wanted to invite Fort Bend County Fire Marshal and also Emergency Management Coordinator, Mark Flathouse, for an update. Mark.
As the Emergency Management Coordinator of Fort Bend County, we're moving our Emergency Operations Center to Readiness Level 3 to assist Health and Human Services of Fort Bend County under the direction of Dr. Minter and the County Judge. We're here to supply not only resources but also help coordination with all the local jurisdictions as we move forward with this.
Thank you, Mark. I just wanted to conclude this conversation here. All residents, I repeat what most of these health authority members mentioned. I encourage residents to take every preventive step to avoid spreading respiratory illness by covering cough and washing hands frequently, staying home if you are sick. I assure all residents in Fort Bend County and in this area, all the top local, regional, statewide entities and experts are on top of the situation. We will do everything possible under our power to ensure that safety and well-being of our residents are the most important thing for us, and we will continue to work and monitor the situation and keep updating our residents ongoing. At this point, we will encourage a few questions, and I will invite respective authorities to come and answer those questions. Yeah.
Many of our readers believe that the media is blowing this out of proportion. 60 to 70,000 people a year die of the common flu. They're saying the media is blowing this out of proportion. How do you guys respond to that?
So do you, Doctor, you wanted to, please go ahead.
Thank you for that question. I think what we have to remember is that there are a number of real concerns that are out there. We have been watching what's been happening in obviously China and Asia, and looking at what's been happening across the globe. It is true that there are thousands of people that die of seasonal influenza every single year. In fact, we are still in the middle of flu season. And so what we want to remind people is that it is absolutely critical that we take all the steps that we can take on a daily basis that, by the way, protect you from a variety of illnesses, including influenza, but also other respiratory conditions. Why this is concerning to us as public health officials is that this is a novel virus. It has made a jump from animals to humans, and because there has been evolving information related to this, we just can't let our guard down. And that is absolutely critical to the work that we do. We remain prepared, we remain committed to protecting our communities, but this is evolving, and we want to make sure that we have all the information to our community members so that they can do what they can to protect themselves as well from a variety of diseases.
Do we know how many people that patient has come into contact with?
So we've started the investigation. We have some details. We do not have all of the details. It would be premature for me to share them now. As soon as we have those, that information available, we will.
How long, do we know how long it took for him to demonstrate symptoms?
Right. Again, we don't have all the details. We have started the investigation, but we don't have all the details as of
Do we know how he came to the attention of medical personnel? Was it through his doctor? Did he
It
go
was.
to the emergency room? His own doctor?
Mm-hmm.
Where and when did he travel?
Yeah, go ahead.
So that information is information I can't share with you about that patient right now.
Has he been out in the community or is it work?
Right. So again, that information is evolving. We don't have all the details. When we have all those details, we will be able to share.
Can you talk about any of the symptoms he experienced to make him go to the doctor?
Right. So I think that would also be a violation of HIPAA, so I don't want to talk about those symptoms, but he presented with the symptoms that most of the people that would be tested would present with.
Is he in a compromised medical condition?
He is in stable condition.
But I mean, did he have pre-existing conditions?
Oh, he did not. He did not. Okay. According to his doctor who I spoke with last night and this morning, he did not.
Is there any contact tracing going on already?
There is. It has already started.
Can you just put the community at ease, share a little bit about that?
I cannot, because it's ongoing and it's just started. As soon as we have more information, I will share.
Can you tell us where the hospital he's in or where this happened?
That I cannot share.
You can't tell us what part of the county?
I cannot share that information.
Well, how should people in Fort Bend react? Should they continue on about their lives? What should they do?
Absolutely. As we said before, this case was associated with travel. So we do not have any evidence of community spread at this time.
This may be a question for Dr. Purse specifically. The lab able to start testing tomorrow, would that mean that results will no longer have to go to the CDC, or will they still be sent to CDC?
That's a great question. So we will be able to do the tests locally. It takes about a day for the whole testing process to occur. So the answers will get back to the clinicians generally the following day after the specimen is submitted. The presumptive positives will then go to the CDC for confirmation, but a presumptive positive is an actionable positive. So we'll be treating those as if they are actual positives. In the unlikely event that there's an issue determined at the CDC, will then address it then. But based on what we know at this point, we think that's going to be a rare event. But as you remember, there were problems with the testing before, and so the CDC is going to this extra level of scrutiny just to make certain that what we're calling presumptive positives are in fact positive. But we don't expect any problems in the testing that has gone on the last couple of weeks with this. The preliminary work with this current process of testing has been quite satisfactory to the people in the lab. They're very confident that it's extremely reliable. So,
How long ago did you do this test, and do you have any other tests going on for Fort Bend County people right now?
Oh,
Or Houston?
well, that's
Because Houston did the test, correct?
Other testing in Fort Bend County, we have this test out. I do not know of the other tests that we have out.
When can we expect the results from CDC?
1 to 2 days. I believe it's 1 to 2 days.
Did you say there are no other tests out, or you don't know
I am not aware of any other tests
in
out
Fort
right
Bend
now.
County? How about in Harris County? Are you conducting any other tests?
Yeah, so I want to reemphasize. Dr. Purse and I have had this conversation, I know, with the media on multiple occasions, and we want to continue to reemphasize that it's absolutely critical that what we are doing is we want to make sure that we do not have any situation where any individual in our community who has been traveled and been exposed somewhere for some reason feels hesitant or not wanting to come forth to a public health authority, to a healthcare provider. And so as regional public health departments, we have decided that the investigation of diseases that we do all the time with our healthcare providers is happening as it happens every year, even before novel coronavirus. It's going to happen well after novel coronavirus. We're going to continue to do those investigations. But we're only going to be providing information when we have a confirmed test positive. And as you know, that means that we remain committed in Harris County, City of Houston, and our region to be really talking about confirmed cases and not a lot of rumors that are out there, because there have been significant amount of rumors about this. And so I know it's difficult because people want to have all this information about how many and what are the numbers, but we're doing this out of an abundance of caution because we really do believe that there is a potential that someone may not come forth to public health authorities because they feel that that information may be getting out and they will somehow be singled out, and we want to be really careful of that. So that's the reason that we're not providing that information. Dr. Purse, if you have anything to add to that, but I just want to say that's the reason that this is really about confirmed case and the presumptive positive that Dr. Minter described.
With viruses usually being seasonal, do you all believe that when it starts to get warmer that this may die down a bit, go away?
You know, I think it's a really good question, and I'm hopeful that we will have an answer in the summer months, but we don't know. The honest answer is that this is an evolving situation, again, with a novel virus where we may have a lot of potential theories of what's going to happen in the summer months, but we don't know. We really don't know how this is going to play out. We're hopeful, though, that as we get through flu season, and as we know that summer in Houston starts pretty quick, so we're hopeful that that is going to give us some relief across the country from, and even across the globe, from the amount of activity that may be seen. But we just don't know. It's too early to tell.
Can you tell us what airline, what airport this patient traveled through?
No, I can't share that information.
All right, we're gonna go ahead and cut this short, Dr.
Okay. Once again, I just wanted to thank each and every one of you to be here, and I appreciate you're getting this information out to our residents. And I just wanted to promise our residents, like I said, I'm repeating again, we will do everything possible. All these authorities, as you can see, they're not just from Fort Bend County. They're coming from this region because we are taking this seriously, and we care about our citizens' well-being. And so we will continue to monitor, continue to update our media. And thank you for all the good work you are doing. Once again, thank you. Good night.